A few ways that hospitals can integrate and work together with primary care physicians in keeping them independent is through a collaboration. Often you're seeing hospitals look at the total cost of care now for the community that they deliver care. And it's important to involve those independent providers, not just the providers that are under their particular tax ID or their employed medical group. And so by doing this, you can deploy resources of care management into the practices. You can develop home strategies to help these independent practices really succeed together. And as a byproduct of that, you're going to build loyalty with that particular healthcare facility. A key component to success in value-based contracts is operational workflow. You can take data in several different fashions, and you can analyze data for providers. But the key to actually performing under a value-based deal is to use data and infuse it in the provider's fingertips within the workflow at the provider-patient interaction. You can do these a couple different ways. You can look at clinical care gaps that are presented at the point of care. You can look at clinical decision-making tools that help the patient decide should they do a procedure or should they do medical management. You can also utilize hierarchical conditional categorical codes or RAF codes that for the provider can understand how sick this patient really is and maybe what types of treatments could they deploy differently because the patient looks and presents differently to them. Organizations that are using data in our industry have to use it very intelligently. We can use claims data to actually drive performance change. Doctors love looking at data. You need to have it as black or white to them. And when you utilize data, it needs to be digestible and actionable. And so an easy thing to implement is to look at specialist costs and decide from claims data you can infer how specialists rank. Are they high cost? Are they low cost providers? And as such, you can present this information to physicians, helping them narrow a network of preferred providers and helping the patients find the right providers to get the right care at the right time.